Welcome to the Explainer. Today we're jumping right into a really common prescription medication, Tamsulosin. You might know it by its brand name, Flomax. We're going to break down exactly what it is, how it works, and everything you really need to be aware of. So, if you or maybe someone you know has a prescription for this, chances are you're dealing with a common condition called Benign Prostatic Hyperplasia. We just call it BPH for short. It's a non-cancerous thing that happens to a lot of guys as they get older.
Yeah, BPH. And that's pretty much the main reason a doctor would prescribe Tamsulosin. It's all about tackling those really frustrating urinary symptoms to help you get some comfort back and, improve your quality of life.
All right, so here's what we're going to cover today. We'll look at the problem it solves, how it actually works its magic, the right way to take it, what to expect with side effects, some super important safety warnings, and then we'll wrap it up with the key takeaways. Let's get into it.
Okay, first things first. Let's really understand the problem we're trying to solve here. What exactly are these symptoms Tamsulosin is supposed to help with?
This is a great way to think about it. BPH symptoms kind of fall into two buckets. On one side, you've got what are called obstructive symptoms. You know, that weak stream, feeling like you can't get started, maybe some dribbling at the end. Then on the other side, you have the irritative stuff. That's the constant urge to go, going all the time, and, of course, getting up in the middle of the night. Tamsulosin is designed to go after both of these.
So the big question is, how does this stuff actually work? It's pretty cool, actually. It doesn't shrink the prostate itself, which is what a lot of people think. The mechanism is way more targeted.
This breaks it down perfectly. So, step one, you've got the problem. The enlarged prostate is literally squeezing the urethra, and the muscles around it are all tensed up, blocking the flow. Step two, this is where Tamsulosin comes in. It acts like a key, but for a very specific lock called an α₁-A receptor. It blocks these receptors, basically telling those muscles to chill out. And step three, the result, the smooth muscles relax, that squeeze on the urethra loosens up, and boom, urine can flow way more freely. And that's the key word right there, Selective. It's a bit of a mouthful, but it just means the drug is smart. It targets the urinary tract specifically. And why does that matter? Well, because it's so targeted, it tends to have fewer effects on your blood pressure compared to some of the older, less selective drugs. That's a huge plus.
Okay, let's switch gears and talk about the practical stuff. How do you actually take this medication? Because believe me, getting this part right is super important for it to work properly.
All right, listen up because these details are absolutely critical. It's just one capsule, once a day. But here's the catch. You have to take it about 30 minutes after the same meal every single day. The food is essential. I can't stress that enough. It helps your body absorb the medicine correctly. Without it, you're just not getting the full effect. And please, swallow the capsule whole. Don't crush it, don't chew it, don't open it up, just swallow it whole.
All right, like with pretty much any medication out there, we need to talk about side effects. It's always good to know what you might expect, right?
So this table lays it all out pretty clearly based on how common things are. At the top, you've got the very common stuff, and we'll dig into that one in a second. Then you have the common things, like maybe feeling a bit dizzy or getting a stuffy nose. And then way down at the bottom are the really serious but thankfully rare side effects. Those are the ones where you need to get help right away.
Okay, so let's tackle that very common one head on. It's called retrograde ejaculation. What does that mean? Well, it basically means that when you orgasm, the semen goes backward into the bladder instead of out. It's often called a dry orgasm. Now, the most important thing to know is that this isn't harmful, and if you stop taking the medication, it's completely reversible.
Okay, now for a really important section. We have to cover the crucial safety warnings. This is the stuff you absolutely positively must know and discuss with your healthcare provider.
First up, drug interactions. This is a big one. If you're taking other alpha blockers, certain blood pressure meds, or even erectile dysfunction drugs like Viagra or Cialis, you have to be careful. Combining them with Tamsulosin can cause a really dangerous drop in your blood pressure. So please, make sure your doctor has a complete list of every single thing you take, including supplements.
All right, are you planning on having any kind of eye surgery, especially cataract surgery? If so, you need to pay very close attention to this next part. It is absolutely vital. And this isn't a suggestion, it's a must. You have to tell your eye surgeon, your ophthalmologist, that you are taking or have ever taken Tamsulosin. Why? Because it can cause this thing called intraoperative floppy iris syndrome during the surgery. Your surgeon can prepare for it, but only if they know about it ahead of time. And it doesn't matter if you stopped taking it a year ago. They still need to know.
4 hours. Remember this number. It relates to a rare but very serious side effect called priapism. That's a painful erection that lasts for more than 4 hours. If this ever happens, it's a medical emergency. You have to get to a hospital right away to prevent any permanent damage.
And finally, let's be clear about who shouldn't take Tamsulosin. Obviously, if you have a known allergy or hypersensitivity to it, it's a no-go. It's also not meant for women or children, and if you have severe liver disease, it should only be used with extreme caution under a doctor's close supervision.
All right, we've covered a lot, so let's bring it all home and talk about the key takeaways. What are the most important things to remember from all of this?
This is probably the single most important thing to understand. Tamsulosin is for managing symptoms. It helps you pee better by relaxing those muscles. It does not shrink the prostate, and it does not cure BPH. That means if you stop taking it, those frustrating symptoms are probably going to come right back.
So, now that you have a much better handle on how Tamsulosin works, the big question is, what will you ask your doctor? Being informed is the best thing you can do for your own health. Hopefully, this explainer gives you the confidence to have a really good, productive conversation about your treatment plan.